What are 5 of the most common symptoms that can persist for months and years following a concussion or a head injury? I'm Dr. Zam, known as the Brain Guy. Knowing these 5 symptoms is critically important because unfortunately I get patients on a daily basis who've been suffering with concussions for years and they did not know it because they were never properly diagnosed. So what are the 5 symptoms you should know? 1, headaches. 2, brain fog. 3, fatigue. 4, problems of focus and concentration, ADHD, and lastly, mood changes, depression, anxiety, irritability, and so forth, okay? Those are 5 of the most common symptoms that persist for months and years following concussions. Unfortunately, 50% of concussions are not diagnosed in the emergency room. Of those diagnosed, another 50% actually do not have a proper follow-up. So this is a really big issue with people, 1, not getting diagnosed, 2, not following up, and lastly, of those that do get proper diagnosis, have a follow-up, most of them don't actually ever receive the treatment they need. You know, they'll kind of let it try to self-resolve, or it'll ultimately get blamed on those other symptoms that we've talked about. And this leads to patients seeing a variety of providers. Maybe it's physical therapy, chiropractic, psychiatry, and they're each kind of doing their own thing. You know, one person's like, well, I'm working on your headache, so I'm working on your neck and that side. Someone else, well, you've got concentration issues, I'm going to give you a medication to help with your concentration. Now the problem is we're treating these as if they're all separate things, when in reality these are all signs of the brain not connecting in the way it should from a concussion. So when a concussion is actually properly treated appropriately, you now start getting a cascade of symptoms that all start improving, because once again, these are all a reflection the brain is not working the way it should. So what should you look for in a concussion evaluation? When we look for concussion evaluation, you want to make sure that you evaluate how the brain's connecting. Your imaging is going to be normal in the overwhelming majority of all concussion scans, okay? So what's the best way to actually do this? Well, you want to look at balance and eye movement testing, specifically using computerized systems that can actually record what's happening. So record your eye movements, record what's happening on a balance platform. Next, really if you're over the age of 20, you also want to make sure your labs are being done. Are the factors working for you or against you? Because if you've got blood sugar issues, thyroid issues, hormone issues that are not being found and not being addressed, that's also going to impact your ability to recover. So I hope this information helped you. If it did, and please comment and let me know. If you want to work with me one-on-one, please visit my website, idahobrainandbody.com, to get started today and request your free consultation.